Hello, everyone. This is Dr. Andrew Campbell, and this is a new webinar titled Environmental Influences on Autism, the Role of Mycotoxins. And this is via medical evidence. This is not from internet and social media chatter and opinions that are on a lot of websites with no medical facts to back them up. Just anecdotes and stories. So here we go. I wanted to, this is basically some of the things that I do. I'm the editor-in-chief for various medical journals. I'm medical advisor, reviewer on editorial boards, and I give all this information to educate. I don't sell. I don't have, I have a special on my website, 20% off my something I'm selling, or so on and so forth. I don't do that. I'm a very ethical doctor that feels that you should educate people so that they can get well again. So here is a typical slide that I have, and I've given this at courses at medical conferences, when I've taught at universities, medical schools, etc. The keys to solving problems caused by toxins is first, detect the cause. Second, remove that cause. And third, repair the damage it has caused to the body, and the patient is healed. I don't treat, I try to heal patients. And I also want to make sure that people get well and stay well. What are the risk factors for autism? Number one is mycotoxins. The others are, for example, living near a freeway. That's a risk factor. Why? Because the air pollution, and this contains, among other things, diesel particulate matter. These are really tiny little particles that people breathe in. The fourth is lead, mercury, nickel, manganese. These are all known to affect the brain and cause damage. Methylene chloride. I think you'd be surprised to realize that that's what is used to decaffeinate coffee and tea. It's used in flavorings. In your aerosol spray, it's used as a propellant to actually spray. And it's used in polyurethane foams. Remember, folks, I'm a clinical immunologist and a toxicologist. This is how I know all these things. Let's talk about glyphosate. It's known as Roundup. It is the most used pesticide in the United States. Actually, we use more here in the United States on our crops than the rest of the world combined. And glyphosate residues are found on main foods of Western diet: corn, soy, sugar, canola, wheat. Pay attention to canola. People use that in cooking oil, etc. And by the way, it goes for fruits, etc. We're talking about everything from grapes to papaya. These residues, what do they do? How do they affect us, this glyphosate? It inhibits an enzyme, cytochrome P450, that our bodies need to detoxify toxins, allowing them to accumulate. And this is in the liver. So here is a slide showing you how glyphosate, this is a number of children from age 6 to 21 with autism, plotted against glyphosate use on corn and soy. As you can see, the autism is in the yellow columns, and the red line is the glyphosate applied to corn and soy. Can you see the correlation? It's very obvious, isn't it? Well, folks, here's 12 pesticides, 12 most contaminated produce from pesticides. And you can see these are common. This is not unusual. This is not something that people don't eat on a regular basis. But I want to also tell you what are the least contaminated. These are the least contaminated, and be aware that frozen sweet corn and sweet peas, not the actual what you can get at the grocery store, but the one that's frozen. Okay, very important. So let me show you this. This is courtesy of Dr. Vojdani, who is at Immunosciences Laboratories, one of the top laboratories in the United States, and it is the only laboratory that provides a patented Lyme test, not like the others, which are not patented. So here you see on the right, that machine reads the pH. pH is the acidity or alkalinity of something. 7 is neutral. Water is neutral, 7. Higher than that is alkaline. The lower you go than 7, the more acidic. So you can see that orange juice is acidic, and vinegar, apple cider vinegar, is even more acidic. What do you think popular drinks are like? Here we go. Even more acidic than vinegar. But do you reach into your refrigerator on a hot summer day and drink a nice, tall, cool glass of vinegar? No. So these products, sugars are added to them in huge amounts, with either artificial sugars, which are chemicals, or real sugar, 12 teaspoons. This is a study on mercury and lead. 203 children ages 9 to 11, and they were assessed for blood mercury and lead. In other words, these two in the blood. And they did neurodevelopmental and psychological functioning assessments and found that children who had elevated levels of these two had disruptive behaviors, emotion regulation, and hostility. So let's talk about vaccines. And I want to say up front, I am not against vaccines because I don't want anybody to get polio. I don't want anybody to get smallpox or anything like that. I've been vaccinated way back, of course, because I'm not a young man. But look at how vaccines have changed from birth to age 6. In 1983, there were 10 vaccines. In 2007, more than 3 times more. And 2017, 5 times more. Why? Why this huge increase? Okay, and here's another one. I don't know if you know this, but every newborn in the United States, first few hours or first day they're born, gets a hepatitis B vaccine to prevent them from getting hepatitis B. Well, excuse me, the mother is tested during pregnancy to see if she has hepatitis B. And if it's negative, they go on with the normal obstetrical care. So why do you give a baby? What is the risk of hepatitis B? 1, you get hepatitis B from contaminated blood transfusion, or 2, through sexual activity with someone who has hepatitis B. So how's a child going to be affected by that? And today there's no mercury, thimerosal, in children's vaccine. It's been replaced by aluminum. But honestly, I don't like aluminum either. Now, I've published a study maybe 10 years ago or so on vaccines. It's in a medical journal. I've published over 100 studies, and that's one of them. Let's talk a minute about climate change, molds, and mycotoxins. We know now that we're going through this climate change, which indicates unexpected weather in most areas on our planet. There are more hurricanes, there's more floods, rising waters, etc. And as a result, disasters, damage, health hazards. Why? Because you have mold-infested homes, schools, businesses, public buildings, like libraries and businesses, whether it's a big, tall building or not. And this is from Indoor Pollution with World Health Organization. Now, the World Health Organization continues and calls mycotoxins the great masquerader of the 21st century. I published a study with this title in December of 2023, going through why the the World Health Organization considers this as a great masquerader, because it pretends to be chronic fatigue syndrome, fibromyalgia, and can cause a number of other problems, which we're going to look at in just a few minutes. The EPA estimates that throughout the United States, between 47 and 68%, in other words, from half to 2/3 of homes, have mold problems. So why? Because cellulose and other materials, drywall, when wet for more than 24 hours, promote mold growth. And mold spores induce persistent changes in inflammatory and immune response in people living or working in that environment. So chronic exposure to molds induce chronic inflammation. So molds multiply quickly. Molds are like plants. When you have a plant, it produces seeds. Molds produce spores, and molds multiply quickly. As they multiply, they release spores, and these spores carry mycotoxins, just like a key on a keychain. And here's a quote: spores of toxigenic fungi contain mycotoxins, and mycotoxins associated with spores are likely to be absorbed via the respiratory tree, in other words, your sinuses and your lungs, and translocated, in other words, taken to other sites of the inside the body, and that produces the effects all over the body. These were published in the 1980s. So folks, this is not something new. That's the important part. Here's two important points. A mold that produces mycotoxins usually produces a series of mycotoxins rather than just one mycotoxin. So no, folks, one mold does not produce one mycotoxin, it produces many. And if a mold known to produce mycotoxins is present in a home or a building when the mycotoxin it produces are there, so you have both. I want to take you to the beginning of life, because this is an important factor. Inside the womb, when you are inside mama, it's a sterile environment. Okay, so from mama, nutrients, the fetus gets nutrients, oxygen, but it also gets chemicals like from medications, over-the-counter drugs, and environmental chemicals, and that includes, of course, mycotoxins. And these are from mother. Now, what does the fetus return to the mother? Carbon dioxide and fetal waste. Now, what happens at birth? Mother's water breaks. There's flooding in this liquid, in this fluid, lactobacilli, and it colonizes the birth canal, the vulva and the thighs, etc., because this gives it an acidic environment and prevents candida and other pathogens from growing in this birth canal. And what happens? The first fluids in the baby's mouth are mother's microbes. When the baby's born, that waxy coating is actually a protective coating against bad bacteria. And people hurry to wipe it off, but I'm telling you, it's there to protect against bacteria. And in my training, I've delivered well over 100 babies in my medical training. And remember, I'm an MD, medical doctor. So what about the first hours and days of that baby? Mother's milk contains lactobacilli. It helps break down lactose, the major sugar in milk. This is the first 2-3 days. It's colostrum, and it also contains protective antibodies from the mother. A few days later, it's regular breast milk, it changes to more carbohydrates. And one of these carbohydrates is oligosaccharide. And this oligosaccharide, the baby's stomach cannot digest. It just goes right through the stomach, and this provides nutrition for the microbes in the baby's gut from when he was born during the birth canal, and those mother's bacteria came into the baby's mouth. That's what starts the microbiome. And folks, don't forget, 80% of the immune system is in the gut. Cesarean section. What happens if there's a cesarean section? In the US, it's about 1/3 of all births. In Europe, only 4%. Why? Well, planning the birth for a specific date due to work considerations, or if the birth is going to fall around holidays, want to make sure that the obstetrician is going to be there and not on vacation, and some other obstetrician is going to deliver the baby. Also for uninterrupted festivities, 4th of July or whatever. The skeptical view is that C-section takes much less time, and doctors and hospitals make more money off a C-section. So you decide which you think is the right one. But remember, in this country, 1/3 of all births, C-sections. Now, what does that cause? That first bacteria that was mother's bacteria in baby's mouth are now those from skin instruments and hospital personnel. They're not from mom anymore. So kids with cesarean section, up to 80% of C-section have asthma of C-section babies. And it doubles the risk for allergies to cow's milk, and it increases the risk for food reactivities later on in life. What happens during the first 3 years of life? And I'm getting to the autism part, so bear with me. We're born with innate immune system. This innate means from birth. Okay, for example, babies crawl around, put everything in their mouth, and they crawl on the floor, and they'll put anything in their mouth, believe me, but they don't get sick because we have stomach acidity, and it's so acid it kills bacteria. That's why a lot of the probiotics today don't work. These lactobacilli bifidobacterium don't work because more than 90% of them are killed by stomach acidity. We'll get into that later. During the first 3 years, we develop immunologically, neurologically, and metabolically. By age 3, we have developed the microbiome that lays the foundation for childhood, adolescence, adulthood, and old age. And this is the time period when we are most affected by toxins and chemicals, the first 3 years. So let me explain that size matters in the body. Hair is 100 microns thick. Mold spores about 2 to 4 microns. Mycotoxins are 0.1 microns, the same size as a COVID virus. An exposure to mycotoxins by inhalation, absorption through the skin. No, it's not from food, and we'll show you a little later. Let's take 2 mycotoxins that people get exposed to regularly if they're living in a mold-contaminated indoor environment or working in one. What do they cause? Miscarriage, stillbirth, prematurity, small for gestational age babies, and stunted for gestational age. And believe it or not, these 2 mycotoxins are found in 73% of amniotic fluid samples from fetuses with genetic defects. Let's go a step further. Mycotoxins are potent protein synthesis inhibitors. They stop protein from getting used by the body. And that inhibits RNA, the formation of RNA and DNA, the formation of DNA adducts and protein adducts. It causes oxidative stress, and it causes mitochondrial-directed apoptosis. What does that mean? Mycotoxins work at the molecular level, not the cellular, molecular. And they go into the cells, whether it's a brain cell, kidney cell, whatever cell, and it goes into the cell, dysregulates the mitochondria, and the cell dies. In medicine, cell death is called apoptosis. So instead of trying to repair or a dysregulated mitochondria, why don't you get rid of the mycotoxins, and then the dysregulation of the mitochondria goes away? So here's from one of the studies. From a mechanism point of view, mycotoxins induce toxicity by inhibiting this protein synthesis in cells, and they cause multi-organ effects, including MSS. MSS is vomiting, and diarrhea, weight loss, nervous disorders, cardiovascular alterations, immunodepression, hemostatic derangements, skin toxicity, decreased reproductive capacity. Couples can't have babies, and bone marrow damage. The blockage of protein synthesis and energy production, the formation of DNA adduct formation, cell death, apoptosis, as well as the induction of oxidative stress, these trigger autism. This is the mechanism. And this is from what journal it's from. Here's from a study from Tufts University published in Clinical Therapeutics. People exposed to mold and mycotoxins present with symptoms affecting a lot of different organs: the lungs, your musculoskeletal system with joint aches and pains, as well as the central and peripheral nervous system, brain fog, sleep disturbance, unusual headaches, short-term memory loss, etc. Furthermore, evidence has recently implicated exposure to mycotoxins in the pathogenesis, in other words, pathological development of autism spectrum disorder. The implications, the information reviewed in these studies showed that exposure to mold and mycotoxins can affect the nervous system directly or through immune cell activation. Therefore, they're thus contributing to neurodevelopmental disorders such as autism. So that's why I went through all that process to bring you here so you understand it. Here's a study from Tufts, again, 172 children with autism and 61 controls who did not have. The authors showed there was significant differences in comparing antibodies to mycotoxins between the two groups. Antibodies to mycotoxin, folks, not urine, with the autism group showing elevated serum antibodies to mycotoxins. Okay, so Tufts University School of Medicine studies have found evidence implicating mycotoxins as causing autism. The study showed that in autism, there's a 10-fold increase in children with mast cell problems, mastocytosis, as compared to the general population. Folks, that's the IgE antibody to mycotoxins in the tests. In addition, 1/3 of patients with mastocytosis complain of neuropsychological symptoms like fatigue, cognitive impairment, and depression. Well, now do you understand? Where do mycotoxins first affect the body? They affect it in the brain. That's the overwhelming medical and scientific evidence. It's the brain and nervous tissues. And mycotoxin antibodies bind to human tissues, including neural tissues in the brain, such as myelin, triggering demyelination. What does demyelination bring on? Multiple sclerosis. So here's a case report. This is an 8-year-old boy. Parents have gone to numerous pediatricians, pediatric neurologists, naturopaths, etc. They've used various prescription medications such as these, And these are the common ones. They've tried various supplements, behavioral supplement, therapists, diets. Nothing has helped, and that includes binders. There was mold in the home. What did this child have? Poor sleep pattern, sleep 2-3 hours at a time. Sometimes got aggressive with biting and scratching people. And of course, repetitive movements, very poor verbal skills, mainly making noises with his voice. Plays alone, no sense of danger, and avoids any kind of physical contact. This is a SPECT scan, single photon emission computerized tomography from Dr. Daniel Amen's group. On the left is a healthy brain scan, and on the right, you can tell the difference right off just by looking at it. Here's the mycotoxin testing from MyMycoLab. Do you see how much red there is? And treatment was a mold-free environment, gluten and dairy-free, organic foods, fresh juice and water. Fresh meaning squeezed, not from a bottle or whatever. For the probiotic, a spore-forming bacilli, I use Megaspore Biotic. Phosphatidylserine, not choline. Phosphatidylserine, because it's shown to help in remyelination in double-blind, placebo-controlled randomized studies. I get it from Clear Labs. It's called Cerebella. Omegas, I get it from squid, coenzyme Q10, curcumin, and resveratrol. These last two, curcumin and resveratrol, are very good anti-inflammatories. Itraconazole, 50 milligrams is what we gave this particular young man due to his weight, twice a day with food. You always give it with a little food because it absorbs faster. And of course, magnesium glycinate in this case. Remember, folks, there's 6 types of magnesium. Some magnesiums are used in medicine as a laxative, so get the right kind of magnesium. The parents noticed improvement in all areas after 2 months of treatment. Sleep was the first one to change and improve, and then there was little by little, less repetitive movements, less aggressiveness, more sociable, better verbal skills, accepting affection. At 8 months, mostly well, playing with others, etc. And folks, I've done this for the last 25 years. I've seen it time and time again. These children are cured. Here's the testing afterwards. There's no red at all. So what's the difference between the IgG antibody and the IgE antibody? I get this asked a lot. The IgG antibody to mycotoxins indicates a current toxic reaction in the body and or colonization. You can have both. IgE antibodies to mycotoxins cause mast cell reactivity. If the IgE antibodies to mycotoxins are very high, this may indicate mast cell activation syndrome. And folks, we just published a study 2 months ago in April 2024 with this, and I'll share it with you at the end. What is the most precise and accurate test for mycotoxins? With both IgG, toxic reaction, IgE, mast cell activation, for 14 different mycotoxins. MyMycoLab, and it's available internationally. Can mycotoxins be causing, well, let's look at what published studies say. Pandas and PANS, autism, POTS, autoimmune diseases, EMF sensitivity, breast implant illness. I've published 23 studies on how these cause breast implant illness in both silicone and saline implants. And I've published I've got over 100 publications, so I don't need to get into them. So people tell me, I also have Lyme, I'm positive for Epstein-Barr virus, cytomegalovirus, I have heavy metals, etc. If you're positive for mycotoxin antibodies, then those tests, Lyme, Epstein-Barr, etc., will cross-react. The test will be positive, but you don't have the disease. So don't fall for taking medications because of the test result. I treat a patient. I don't look at a piece of paper and treat that piece of paper test result. And Lyme disease and mycotoxins, how do you tell between the two? Well, here's a study that was published, and these show unsuitable diagnostic tests for Lyme. So this shows you that the PCR tests, urine tests, the LE spot test, et cetera, are all unsuitable. That means that the tests from Vibrant, Hygienics, these are not suitable. Neither is the VCS or the gray shade scale. That test is really almost, a bunk. All these tests, this CD57 positive, all that stuff. Forget it, folks. None of these should be used for Lyme diagnosis. What about stools? Look at this study. They took stools from a healthy person that was screened for bacteria and parasites. None were found. They spiked the stool with 14 different bacteria and 2 parasites, and they sent it to 2 different labs. What did GI map show? It was only 26% specific. So if you're using GI map for your patients, this means 74% is not specific. And the study, this is from a study published in 2020. You can see it up on top. And this is courtesy of Dr. Ari Vajdani, this slide, and the next 2 or 3. So remember, know what the lab is doing. And here's one about finding imbalances in gut bacteria and fungi, oat via urine, all this. So these markers on these tests do not measure what they claim to be measuring. And this is from another publication. What about chemical antibodies in blood versus chemical presence in urine? Many labs focus on the level of chemicals in urine, but this is what's already passed out of the body. It's not what's in the body. We should measure immune response to the chemicals by antibodies, okay? And that will give you the chemical body burden, how much is in the body. This is also from Dr. Vajdani. So look for body burden of chemicals, not chemicals that are coming out in the urine. So again, mycotoxin antibodies versus don't do the mycotoxin in urine. What about supplements? This is very interesting. A person wrote to me that their daughter went to see this naturopath and is taking 40 different supplements. That's ridiculous. That is poor medicine. And I'm not going to say any more than that. So here's what a recent study found. 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients listed on the label. So 11%, what they did is they took all these 60 most popular supplements, took them to the lab and read what's on the label and checked what's inside. 40% of these supplements did not contain a detectable amount of ingredients at all. 40%, folks. Binders. Animal studies in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, and mice have shown that specified binders can remove mycotoxin from those animals under precise laboratory conditions. There is no medical or scientific published studies to support their use in humans. Here's a study showing binders rely on the thinking that mycotoxins in the gut will be absorbed and instead of getting into the blood. That is a joke. Included were kaolinite clays, activated charcoal, zeolite, bentonite, and all these things. And these are so popular, especially among naturopaths. And they're effective in neutralizing one mycotoxin, aflatoxin, which is not found in contaminated indoor environments, contaminated by molds that produce toxins, by toxic molds. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements, such as zinc, magnesium, etc. So what does this show you? Binders don't work. What about itraconazole? Isn't taking itraconazole bad for the liver? No, folks. So here's itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It's been in clinical use for 35 years with an established safety record. Here's some more. This is another study. Itraconazole is a broad-spectrum triazole antifungal agent. It has favorable pharmacodynamic and pharmacokinetic profiles and is available both as oral and IVs. Itraconazole has proven to be a valuable addition to antifungal drugs currently available for treatment. It has been well tolerated with doses of up to 400 milligrams a day, being generally free of serious adverse effects. And please don't take fluconazole, okay, diflucan, because it's only for single cell molds. It does not work against multi-cell molds. Single cell molds are all your yeasts, the ones used to make beer and alcohol and bread and all those things. It won't affect, fluconazole will not affect Aspergillus, Stachybotrys, and all these others. Itraconazole will kill both single cell and multiple cell. How long will it take me to start feeling better? Well, folks, with the wrong diagnosis and the wrong treatment, patients continue sick and get more sensitive. And I get emails all the time, every day, from people who've been sick for 3, 4, 5, 7 years, and they're taking all these things that don't work. Well, why take it then? Okay. For the treatment that I have used, and it's been published, it takes about 8 to 10 weeks to start feeling better once you're away from the toxic mold. And if you are in treatment and all of a sudden you feel bad, it's because you were re-exposed again. So what if I have low levels of mycotoxins on the blood antibody testing? Well, let me ask you this. How much toxin is okay to have? Are low levels of mercury okay? Low levels of glyphosate? What about arsenic? Well, obviously the answer is the best levels are no levels. Here's an older couple. I know these are not autistic people, but we both did the mycotoxin testing, and my wife's was higher than mine in many. We couldn't get out of bed in the mornings for extreme muscle tightness, covered in psoriasis, systemic arthritis type joint pain, fatigue, mental fog. We've been on itraconazole for 3 months, and we have improved 95%. Hi, Doc. Listening to more of your videos, lectures, and interviews while now waiting for the test I ordered from MyMycoLab. It is truly amazing how much misinformation is out there and how these mold treatment doctors put a slant on everything, which all leads to getting sucked into their tests and treatment. I couldn't agree more. Here's one that I just got recently. Long story short, after years of suffering and seeing all the possible doctors and spending more than 2 months in a hospital after surgery for my gallbladder. I saw something on the internet about mold illness, and I contacted a functional medicine practitioner, initials EB. I didn't want to put his real name. He's not really a doctor. He's a nutritionist. I did some testing and came back with high ochratoxin, which means the urine testing, because every urine test contains ochratoxin. He put me on a protocol with 20 different supplements, which I tried to start many times, but my body can't tolerate it. Wrong treatment. Here's another one. You asked me to let you know when I was consistently well because of taking itraconazole. It was dispensed on May 11th, 2023. Today is June 10, 2023. That is 31 days. I believe the itraconazole, along with the probiotics, have healed me of irritable bowel syndrome. 30 days, folks. Here's from an actual doctor. ALS patient reports he's beginning to have feelings in his feet again. He's been on itraconazole for about 6 weeks. So, folks, did you know that itraconazole is now being used also for cancer? The left two pictures show this huge cancer growing on this person's forehead. It's very obvious that it's cancer. Day 51 of itraconazole. In other words, 59 days of itraconazole. Can you see the difference? And there's more studies on that. It's on cancer and itraconazole and how cancers are caused by toxic molds. It's in my other webinars. This one is on autism. I wish I could show you the before and after pictures of children, but I don't believe in doing that because these are children. The parents can decide, but maybe later on in life, they could be embarrassed by it. So I just don't do that. And folks, for more information, email me, immunedoctor@gmail.com. Latest study on mast cell. Here we go. We just published it in April 2024. Mycotoxin triggered attacks of nausea, vomiting, and abdominal pain, and episodes of pseudo-obstruction. There you go, folks. I hope you've enjoyed this. I've seen so many kids with autism. They now come see me. I had one visit recently because he's in school. He's in normal school. He's doing great. And he's on the swim team. And he's doing wonderful on the swim team. And he's made a lot of friends on the swim team. He just wanted to come in and say hi to me. It's so nice to have these children who 5 years ago, he was totally autistic. And then I've treated him, and he comes in maybe every 2 years or so and tells me what he's doing. Very nice young man. He's now, by the way, 15. I've had others. Parents cry because they see now their children are well and can go to school and get an education and eventually make a living for themselves. So, folks, do the testing for mycotoxins. Let me take you back to that slide. And MyMycoLab.com. And then treatment. It's not a forever mark on that child's forehead. No, it can be treated. All righty, folks. Thank you so much. And see you next time.